Now, this week, we are sure that you have seen this viral video and images of queues in Bristol for a dentist. Absolutely unbelievable. Some people actually got there at 5 o'clock in the morning, would you believe?
It's like going to a concert. Yeah. Well, the government has announced that dentists who set up practice in areas of England with poor access to NHS care will be offered a £20,000 bonus.
Yes, the government also say that dentists who take on new patients and teeth cleaning in schools will be financially rewarded.
Is this an industry that's in decay? Well, joining us in the studio now is dentist and king of celebrity smiles, Dr Richard Marques. How are you? Lovely to see you.
Yeah, really good to see you this morning. How have we got to this point where we have people in this country in 2024 queuing at 5 o'clock in the morning to join a dentist practice?
Yeah, obviously it's pretty bad, and it's just been kind of steady decline really since 2006 when they changed the dental contract, and there's been a real cut in funding for dentistry. So now that's why we're calling on the government to kind of fund dentistry properly, increase the number of dentists, increase the number of dental practices, you know, in cities and in rural areas. Yeah, especially NHS care, obviously.
Yeah, I mean, obviously this has now led to people doing DIY dentistry, which of course is not pleasant and not safe. I mean, have you seen the cases of this rise?
Yeah, so people use household tools to actually do things, like pliers to trying to take their own teeth out.
Yeah.
Because the pain is unbearable.
Pain is unbearable.
Yeah. There's nothing like toothache, though, is there?
No, they say because it's nearer your head, you know, it's nearer your neural centre, your central nervous system. Toothache, earache, toothache is one of the worst, you know.
You can see why people very sadly get desperate, can't you, and turn to those drastic measures because they can't get into a dental practice. And if you're in that much pain, I assume you would do anything, wouldn't you, to try and fix it?
Yeah, and then also, like, people end up going to the hospital in A&E, which then clogs up the hospital system as well. In the hospitals, they don't have the dental tools to actually fix it. One of the dangerous things is if you get dental infection, it can press on the airway or even track towards the eye. So there's some really dangerous parts, and sepsis in the blood, you know, there's really dangerous parts of dentistry which people don't realise, apart from not being able to eat or smile.
So you don't want to risk it.
When people go overseas and they get things done and then they come back and then they have to get things fixed, is that becoming a similar problem but by people doing it themselves now? Yeah,
well, people are going overseas and then the dentists who have to take over the care haven't obviously done the original treatment, so they don't know what's underneath all of this work. Obviously, a lot of people have big white smiles and veneers and implants and turkey teeth. It can cause a lot of problems.
We're seeing the rise of turkey teeth, aren't we? We certainly are. Look, I wanted to ask you about what you think about this golden handshake idea from the Conservatives at the moment. It's a £20,000 bonus being offered to dentists if they move to a rural area where perhaps there isn't a dental practice, and also the idea of paying, I think it's £50 a patient if you see a patient that hasn't been seen in a certain number of years. What do you think about this? Because the Labour Party have said this is just a sticking plaster policy. You can't just throw money at the situation. Do you think this is a good place to start, or do you want to see something else?
Well, something is better than nothing, and at least we've got some intention on dentistry now. You know, it's been kind of left out, and lots of people, obviously, it's part of the health system. Lots of people are talking about doctors and the medical system, which is really important, but dentistry also needs to be highlighted as a really important part of health. So anything they can do to help is good, but there needs to be a lot more. They're right, it is a sticking plaster. It's not enough, and they do need to fund it properly and really draw attention and ring-fence some budget for dentistry.
And your father was an NHS dentist?
He was an NHS dentist all of his life, and, you know, the system changed around 2006, and it was a lot better before that. You know, he treated thousands and thousands of patients successfully, and, you know, I also did a lot of NHS dentistry. I worked with him for a bit, you know, and it is enjoyable because you're helping people out, you know.
Does it make you despair now for your industry? When it's in your blood, isn't it? Your dad's done it, you've done it, you're obviously clearly passionate about it, and then you see people queuing like that, like the scenes we've seen in Bristol this week. It must make you just so worried about the future of your industry.
Yeah.
And the challenges of it.
Definitely, and it's hard to see people, like, left behind, people in pain, you know. dentists, we really do want to help people. We want to fix their teeth. We want to get them out of pain. Like, to see people queuing, you know, with troubles in their mouth, not knowing when they'll get it sorted is really, really hard.
Now, you obviously have a killer smile.
Thank you.
Which is
You
very handy.
really do.
So you would have, let's say, treated a lot of people in the celebrity world. You're very humble, I can tell that, so you might not want to divulge, but if you can, tell us some of the big names that you've worked with.
Yeah, so some of the patients I've done, which publicly talking about, Rita Ora, one of my regular patients, and Rylan, of course,
famous
who became one of the big smiles, Joey Essex, and many other people, you know, obviously quite a few Love Islanders.
Now, obviously, forget Ellie, she's got perfect teeth. So
oh, no, I would like my teeth doing
I was in America, this is a true story, years ago, and a dentist had turned around and said to me, oh, you need to get your teeth done. And if you do it now, I'll give you a discount of $70,000 they wanted.
No.
And I said, well, what's wrong with my teeth, right?
Wow.
And
You got good teeth.
apparently he made me bite into something and showed all the imperfections, but sometimes imperfections are good, right?
That's right.
That's what I told myself anyway.
There's a difference between the American, obviously, like Hollywood, they want the perfect smile. I think British people, you know, more character in the teeth, and we value a natural smile a little bit more.
I'll keep them a bit longer.
Yeah, exactly. Keep your own teeth.
Dr Richard Marques, really good to see you this morning.
Thanks,
Thank you so
guys.
much for your time.